All right, it's time for our Kegel exercises, Twila.
Yes, it is.
And so why do we do our Kegels? Well, it's important for our pelvic health for both men and women. These exercises help support our pelvic organs in women, the bladder, the vagina, the rectum, the urethra. And for some people, it can actually improve sexual functioning. Some people say it makes orgasms more intense and more frequent.
Well, I think that's a good enough reason to do them right
Nobody's going to
there.
argue with that, I don't think. So let's go ahead and do it.
Okay. 3
times a day.
6
Days a week.
9
Seconds per Kegel.
and 12.
Kegels in a row to make a rep. It's so easy. Just do 12 of these 3 times a day. When you're doing them, hold it for 9 seconds. You will be the envy of your neighborhood. You will have a pelvic floor like a chain link fence, so you will be able to pull a trailer.
If you so choose. And don't forget, you can always go to the GynoCast Facebook page and get an infographic, which kind of details out the customizable plan. You can print it out, put it on your fridge. You can put it up in your office. We can share it with your friends. And it's a great resource to have. So Make sure that you go and do your exercises today.
Yes.
Stay tuned.
Welcome back to the GynoCast. My name is Dr. Eric Heegaard.
I am Twila Dang.
And you are listening to the podcast, which we call the GynoCast, which is your go-to resource in the universe. I'm not just talking about...
I like how you say the universe.
The
like
universe.
Somebody in the International Space Station could be listening to this right now. So, hey, what's going on up there?
That actually brings out an opportunity for a very interesting show.
Okay.
We got to talk about gynecologic issues in space. That is Twila.
Okay. I mean, I don't know any astronauts. I know an Olympian, but not an astronaut.
I know somebody who knows an astronaut, though. Oh, my God.
Done. Okay, that's
Boom.
it. Okay. Stay tuned. It's coming.
Okay, so back to what I said. The go-to place in the universe for discussions about women's health, women's rights, women's...
Well, we talk about anything and everything, women's emotional and physical health and well-being.
That's right. And we do it well, and we talk about the things that people really need and want to know about, but don't necessarily know where to go.
Yeah, absolutely.
And sometimes these are subjects that are not conducive to polite conversation, sitting around, milling about with your friends with cocktails, passing the spinach.
They can be a
dip,
little
and that
difficult
sort
to
of thing.
talk about sometimes. Yeah, absolutely.
So, and one of the other things I also want to say, Twila, is what you brought up on one of our other shows. This is the place for vaginal respect.
Okay, I'm putting that on a T-shirt. We're going to sell it. Just keep your eyes peeled. We'll let you know when it's available.
But I want to be very clear about this. The show is not vaginocentric.
It isn't?
No, because women's health has a lot more to do than just the vagina.
Oh, I thought I was getting ready to say, no, we're not talking about dudes here. So I know I was good. That's where my.
So I do want to be clear that this is not the Vaginocast.
No.
It's the GynoCast.
Yes.
We talk about everything and anything that just remotely even touches on the lives of women.
That's
so today we are going to talk about abnormal uterine bleeding.
Okay.
And so I want to go back, and I know I kind of drive this point home again, but the importance of anatomy. And I want to just emphasize this again. The main things that are in female anatomy: ovaries, those release the eggs; tubes, those carry the egg from the ovary to the uterus. The uterus, which is the fibromuscular organ, about the size of a small avocado in somebody who's never had a baby, that bleeds every month when you have a normal period and holds the baby when you are pregnant and delivers the baby. It's fantastic. It's an incredible organism. Organ.
Yeah.
And then the end of the uterus is the cervix, which is almost like a separate animal, but is actually part of the uterus. And that inserts and connects to the vagina, which is a fibromuscular tube, which, as we've talked about on another show, the vagina is a mysterious and wondrous place for a lot of reasons.
Yes, indeed.
People spend a lot of time in both genders thinking about the vagina.
We do.
And so...
As you should.
As you should. But you want to know what's what and what's causing what. We're talking about uterine bleeding today, not vaginal bleeding, although people kind of use them interchangeably, but we're not going to do that on the GynoCast.
No, and what I make sure we let everybody know before we sort of jump headlong into the discussion is you did a really great job of sort of parsing the landscape of what we're talking about, like what the different parts are, and we're going to have a guide, like an actual sort of diagram that can work in your favor, that when we're talking about these issues, if you're curious, we're going to have something available for you to look at. So
this is going to be like Wheel of Fortune. This is going to be Twila and I but we'll have white coats on, and maybe we can I'll talk and you can have the pointer and
or
vice versa.
I was really just going for like an infographic for you guys, but he's just going to get excited.
This is a universe
we're
talking about. We got to appeal to the universe. And so the vagina then leads to the outside, from the inside to the outside, and then you have the vulva.
Yes.
The vulva. And so I don't know if there are any Seinfeld fans. It was a long time ago, but do you remember the episode where he couldn't remember the woman's name, but he had made a little note to himself saying it reminded him of something to do with the female genitalia?
Yes.
And he said, mulva.
Right.
It was very funny, if you happen to remember the
episode. I remember that.
But the vulva is the external genitalia. And so the vagina is not on the outside.
No.
The vagina is the tube that leads from the outside to the inside. And the external genitalia, the vulva, is the clitoris, the labia majora and minora, and the skin thereabouts.
Yes.
Okay, so we were talking about uterine bleeding, abnormal uterine bleeding. Why? Why does anybody care? Well, nobody wants to. I don't know about you, Twila, but most people like to know when they're going to have their period.
Yeah, I agree.
We spend a lot of our formative years.
And by we, he means us girls.
Well, yeah,
us
we
ladies.
girls. Can I just include myself?
Listen, you're in the club, Sister Soldier. I told you before.
Okay, so we ladies, but I'm going to talk about the humankind in general.
Mm-hmm.
We spend a lot of time trying to control our bodily functions because of social reasons.
Yes.
And so, we all have these bodily functions, and we all go to the bathroom. If you're a woman, you have vaginal bleeding. We all eliminate gas from our rectums. We all have odors that come from our mouths and our armpits and our nether regions. But we want to kind of have control over that.
Yeah.
And so most women, I'm just gonna throw this out, but my experience in women's care says most people want to know when they're going to have their period.
Yes.
And so they can plan around it.
Yeah, that's not a surprise you like to get.
Right. And so, abnormal uterine bleeding is when you have bleeding that is either in excess of what you should have or occurring at a time when you are not expecting it.
Okay.
So the period, I'm going to ask you this.
Okay.
How many days between the beginning of one period and the beginning of another period is normal, Twila Day? 21 to 35.
You didn't give me a chance. I had it on the tip of my tongue. I know these things.
All right. Well, okay. Well, I just didn't want to have one of those awkward silences.
Well, if I didn't know, I was going to tell. I always tell you when I don't know things.
Okay.
Well, I had an inkling this time.
Okay. Well, then I'll ask you another question.
Oh no, now I'm not going to.
Okay.
Know this
So
one.
anywhere. Oh, yeah, no, that was the easy one.
I know.
So anywhere between really 3 to 5 weeks.
Yes.
From the beginning of one period to the beginning of another period is normal. And that leads, again, into this wondrous kind of mystery of how this affects other things in our body. When you're talking about trying to get pregnant, bang, having to know that interval is a big deal. And we've talked about that in one of our other gynocasts.
Yes, we talked about
sequences.
infertility.
But, so, we got to know what's normal. So 3 to 5 days apart. How many days is normal to have a period?
How many days?
Yeah.
Well, 3 to 7.
Yeah, good. Yeah. And around there.
Yeah.
Is it normal to have bleeding between periods?
No.
Although I will have a little caveat. Some people have a little spotting around the time of ovulation, but it shouldn't be
excessive.
Yeah. And as a little public service announcement, we're talking about in abnormal uterine bleeding here, really in the premenopausal woman.
Okay. Not
postmenopausal, because postmenopausal women should not bleed. They should not have any vaginal bleeding.
Right.
And if they do, bing, 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 you got to get in. This is not one of these things where I will say, well, just why don't you sit around and watch it for a while. And if you have bleeding and you're postmenopausal, it should not happen. You got to get in and get it evaluated. Most of the time it's nothing, but it is the hallmark sign of uterine cancer.
Okay.
You
should, so definitely, if you see any, just take precaution, go see your physician.
That's right. And I remember in our old days on live radio, I actually had a patient who let me know that she had been listening to one of our discussions, went in to see someone. She had uterine cancer, had her uterus removed, and she will live to be 105.
Oh, wow.
So, and it's a very preventable disease, or not preventable, what it is, to a certain extent, but it's a very treatable cancer if you catch it early.
If you catch it early, right.
So we're concentrating mostly on premenopausal women.
Okay.
And so I want to focus on that. But so, 3 to 5 weeks apart, 3 to 7 days long, generally, no bleeding between periods. That's normal. Now, let me ask you this.
Okay.
How much in terms of volume
is
normal bleeding?
Pass. I don't know. I do not know.
How many tablespoons?
Oh, I don't know. I don't even want to think about it. I can't. Brain shutting down now.
How many cc's of blood is normal?
Pretty sure my brain is melted and is now exiting my ears. That's okay.
What is normal amount of discharge per day?
Like a tablespoon.
Right. So,
but I can deal with that. Yeah. And that's because I learned that from somewhere else. I don't really want to know the volume. I mean, some days it seems like a massacre, so I don't want to know. I really don't want to know.
Well, let me just tell you, I'm asking you this because
I mean, it's a legit question.
Well, I didn't even know the answer. Okay. Let me tell you this.
What?
I had to look it up before we did this.
Okay,
podcast.
you're the gynecologist.
Because nobody really cares. You know, the actual definition is like 5 to 80 cc's of blood.
80.
So, 5 cc's in a tablespoon. So what is that? 16? Is that 16 tablespoons of blood?
That's a lot of blood.
16. Anyway, but it's a lot of blood. But who cares? Because
I'm going to get emails about period shaming. I'm not period shaming. I'm just not. I'm always in some level of period denial because I've had it for a long time and I'm tired of it. So believe me, I know.
Yeah. Well, so the reason I bring that up is just mostly because it's just I think it's kind of funny because I can tell you.
I mean, it's interesting to know.
It is interesting, but if you questioned 100 gynecologists and you asked them how many cc's or milliliters of blood is normal for a period, nobody would know.
Unless you just don't think about it.
Nobody's going to say, well, less than 80 cc's is normal for a period. I actually did know that when I was a resident, but because
you had to know everything
I didn't know stuff like that. So the reality is it heavy enough to interfere with your quality of life? And so when it comes down to a lifestyle or quality of life sort of thing, if you are changing a pad especially more than a pad or tampon, or a Diva cup. I don't know a whole lot about a Diva cup.
Ask me, I know.
Do you really?
Yeah,
okay, so
I have them.
Well, Twila, you are just an onion.
I'm wondrous.
Yeah, and so we got to talk about that because I got to find out more about that. But in any case, and I assume it's the same thing for the Diva cup. If you have to change it more than every hour, it's too much.
Yeah,
and every 1 to 2 hours, if you're changing that throughout the day, that's considered heavy bleeding. If you bleed through a pad and a tampon, so if you have to wear with your Diva cup a pad too, that's too much.
Yeah.
If you are waking up in the middle of the night and finding blood on the bed, that's not normal.
Okay.
If you sit on the toilet and it's gushing out, that's heavy bleeding. Yeah. And so these are things that matter to us clinically and to people who are living their lives, and they don't care how many tablespoons they're bleeding. They just want to know, if it's impacting their quality of life, their ability to do what they want to do. That's what matters.
Okay.
And so bleeding and so abnormal would be, bleeding that is in excess of, or involving what we just talked about. Heavy bleeding, and then bleeding that's not happening at a regular, if it's happening between periods, that's not normal.
Yeah,
absolutely. So I'm just going to, and obviously the other things that would lead you in to see somebody, pain, discomfort, that sort of thing, obviously, but I'm just talking about bleeding in particular. So those are the things that should drive you in to see your practitioner, your gynecologist, your family doctor to get further evaluation. Now, I will say this also, as when I talk about getting in to see your doctor, I also want to say, and we have said this a lot, Twila, over the years, is the importance of self-advocacy. So, if you get into somebody and they see you and you think, I don't really believe what they're saying, and I don't feel like they're paying attention to me, get in to see somebody else.
Well, I'm a big proponent of self-advocacy. I tend to say that you say it much more eloquently than I do. I always say they work for you. So if you go in and you're not getting the service that you expect or are treated with the respect level that you think you should be treated with as the patient, guess what you get to do? You get to fire them. You can go find another practitioner. And that's so important. I think we forget so often that doctors are these highly intelligent people, and they have this knowledge base that far exceeds our own. So we give them a certain heightened sort of not only status, but we actually put what they say to us even over our gut instinct, even over what we think or what we feel or what we know is going on with us. Sometimes we let that level of sort of authority override what we know is something that's wrong.
That's right.
And you have to be strong enough as an individual, and you have to work on being strong enough as an individual to stand up for yourself in situations like that. Sometimes it's just that they're busy and they don't know. Sometimes it's they're not sure of the answer. Sometimes they've had an experience that's different than what you're experiencing. So they're cataloging from their history and their experience, and that's okay. What's not okay is if you allow that to stand in the way of you getting the treatment, the service, and the respect that you deserve. If those things are not all being taken care of, go find yourself another practitioner.
Exactly. And also medicine is a huge beast of a thing to understand.
Absolutely.
And there's just, no matter how smart or devoted you are, it's hard to keep track of everything. And so you've heard the old story about the 5 blind doctors and the elephant, right? It's a classic story.
Okay.
Where, they have the blind, let's just say blindfolded doctors.
Okay.
And they have an elephant and they say, what is it? And so, one goes and feels a leg and goes, it's kind of coarse and hard. This is a tree. And the other blind or blindfolded gynecologist or doctor goes and examines a trunk and goes, oh, this is a snake. And the reality is that they're all wrong. How do you like that for being profound?
Yeah.
All right.
I feel like we missed the punchline.
Well, I don't think it's really a joke.
I know. That's the problem.
But the point is that no matter how smart you are, you're always kind of looking at the world through your own.
Well, yeah, what do they always say? Perception is reality. So your perception as the gynecologist coming to the table with information is going to be different than my perspective as, my perception as the patient. I said, and we have not just our sort of intelligence levels that separate some of that knowledge, but our life experiences.
Exactly.
The skin that we're in, me being a woman, you being a man, me being a black woman, you being a white man. Those things all impact what becomes
you being
the
a vegan, me being not.
Yeah, all those things impact sort of the situation you wind up in with an individual, and that's with other individuals, and that's why you have to kind of take those things into consideration. But you always sort of have to understand how to listen to your individual, how your intuition, your gut, your knowledge of yourself. Like we talk a lot on this podcast about how you should know yourself and know your body, because if you know your body, you're in a much better position to advocate for your health when you need to.
That's right.
Support for the GynoCast is provided by OBGYN West. OBGYN West provides the highest quality care from compassionate providers, including women's health issues from general sexual health to pregnancy care, childbirth, menopause, and beyond. Whether it's your teen's first annual exam, a new baby's on the way, or you're facing the special challenges of middle age, OBGYN West provides a wide array of services. Their doctors and PAs are trained in virtually every type of OBGYN service and procedure. OBGYN West provides exceptional care for women.
So if we're talking about uterine bleeding, we're talking about uterine bleeding, not vaginal bleeding. And so this goes to the first question when you're trying to figure out what's going on.
Yes.
Where's the bleeding coming from? Because if it's vaginal bleeding, which is really very rare, where the vagina is actually bleeding, that's a whole different subject, which we'll talk about. But you got to make sure it's not the vagina that's bleeding. You want to make sure it's the uterus itself and not somewhere higher up like the fallopian tube or the ovary. And those are different conversations. But you got to figure out where the bleeding is coming from first. So we know it's the uterus. By exam, by studies, or whatever, we know it's the uterus. And so then you got to figure out, you got to know their age, of course, and if they're premenopausal versus postmenopausal. We've talked about that a few minutes ago. Postmenopausal bleeding is a different animal. You got to get in. You don't even think about it. You got to go in.
Right.
So let me tell you, let's discuss this other subgroup, which is premenopausal women who are not pregnant, who are having uterine bleeding. So before we go into further evaluation on that, let me talk about what makes you have regular bleeding. We talked about 3 to 5 weeks apart, lasting 3 to 7 days, not more than 80 cc's, or basically you shouldn't be bleeding more than 1 to 2 pads an hour, or tampons.
Right.
So, what makes a regular period? Now, this is what I would define is the Dr. Eric G. Heegaard universal understanding of the uterine lining.
Go for it.
And you will hear, if you listen to the kind of show, me talk about this kind of imagery in a lot of different things we talked about.
Yeah, and you do a very, very masterful job of explaining it this way.
Well, thank you, Twila.
So,
thank you so much,
you do.
Twila. Why are you being so nice to me?
it's a setup. No, I'm really
I'm waiting for the hammer to fall here.
No, really and truly, you do. I've heard you explain this before, and I never had as clear of an understanding of how my own body worked in that respect until I heard you explain this. So, all
right. So I'm a very visual kind of person.
Yes.
And simple-minded. And so that doesn't mean I'm not intelligent, but I like to make things sort of understandable for myself and other people.
Well, no, I always tell you, explain things to me like I'm 4. It makes it easier.
Okay, that might be too too simple. But if you think about it, so this is what this is the universal theory of the uterus. And so imagine the lining of the uterus like sod or grass.
Okay.
Just bear with me.
Yeah.
So there are 2 main female hormones, estrogen and progesterone. Estrogen is produced, if you're a premenopausal woman of reproductive years, you are producing estrogen all the time.
Okay.
So every day, night and day, you're producing estrogen. The key thing is progesterone, which is the other main female hormone, is only produced when you ovulate. So ovulate, meaning when you release an egg.
Okay.
And so that's crucial for understanding why and how a regular period is produced. So estrogen is being produced all the time, progesterone only being produced when you ovulate. Now let's go back to that idea of the uterine lining being like grass.
Okay.
All right, bear with me.
Mm-hmm.
So imagine estrogen being like water. Estrogen makes the lining of the uterus, the grass, the sod, grow and get thick.
Yes.
Progesterone, on the other hand, is like a lawnmower. Now, this is not perfect.
No,
but it works.
This makes sense.
It makes sense, but progesterone isn't exactly like a lawnmower, but sort of like a lawnmower.
Okay.
It stabilizes and then thins the lining out. And so, under normal circumstances, the first half of your cycle, before you are going to ovulate, right after your period, your ovary starts producing eggs. The eggs produce estrogen. The estrogen is being released. It's like you have a little elf inside your uterus watering your lawn with estrogen. Just every day out there sitting like Twila's husband goes out and waters the lawn.
Oh, okay. I don't really know what the elf has to do with it, but we're good.
I just
Keep
like
going.
elves. I like elves.
Okay.
So, you have a little uterine elf in there watering your lawn with estrogen, right?
Okay.
And so the lining gets nice and thick and abundant. And what is it doing? It's getting ready for an egg to implant into this hospitable, wonderful, lush, lining.
Right.
And so then all of a sudden you ovulate and you release the egg and the ovary starts to produce progesterone. And progesterone is like a little elf with a lawnmower. So the lawnmower comes out and starts mowing the lawn, and then after 14 days, it leaves and everything sheds off. And then you have your period again. Does that make sense?
I mean, it does for the most part.
You don't like the elf, I can tell.
No, you're not going to. I feel like you're about to make a pitch for like the vaginal elf T-shirt, and I'm not doing that.
All right, so I love elves. I just love the idea of an elf.
No, I think you've always done, before when you explained it, you didn't insert the elf into that sort of explanation.
I've kind of gotten into
But
elves.
you've done a really good job of, I fully understood the idea of sort of like the grass is growing and it's sort of overgrown, and then something comes along and it kind of trims it back and puts it back in its normal context, and then it overgrows again, and it happens again month to month.
That's right.
I get that.
And at the end of that 14 days where there's the progesterone, all that grass that's been collected just kind of gets thrown into the compost.
Right, which is us having our period.
That's right. And so that's how a regular period's supposed to be. So you have, half the cycle being estrogen predominant, where the lining is getting nice and thick, just like grass getting thick from water. And then the other half of the cycle, after ovulation, you have progesterone that is thinning and stabilizing the lining, like the little lawnmower effect.
Right.
And then at the end of that time, when the progesterone levels go down, all that grass has been accumulated, it gets dumped into the compost pile, which is your period.
Yes.
That's how it's supposed to work. And so the reason why that matters is that it affects how we figure out what's going on in terms of causing bleeding. So when we start talking about diagnosing the source of abnormal bleeding in a premenopausal woman who's not pregnant,
okay,
we have to take that into account, because what we're going to do when we're talking to you is finding out, like, we'll ask, do you have regular periods? What are those periods like? Do you have symptoms? A lot of women will have symptoms before they have their period, breast tenderness, bloating, that sort of thing. Mm-hmm. And so you can kind of get a sense of whether they are ovulating or not, because there are situations that occur for a number of different reasons, which is a whole other conversation, where women stop ovulating on a regular basis. So what happens if you don't ovulate? You don't produce progesterone. You don't mow your lawn. What happens if you don't mow your lawn, Twila?
It gets overgrown.
You get a field of thick, lush,
Well, it goes from thick, lush grass to overgrown weeds and
weeds. And so you get this really thick lining, which will become eventually unstable and start to crumble and bleed. And so determining whether a woman is ovulating or not is a big deal, because if she's not ovulating, the reason for the bleeding is that it's just gotten too thick and it's unstable.
Okay.
And so that's one of the first questions we're going to want to know, because why does bleeding occur? Well, one is that the woman doesn't ovulate and it's just an unstable lining. Two, there can be things inside the uterus that cause it to bleed. And by that, I mean polyps, which are overgrowths of the lining. Mm-hmm. So if you go back to the lawn metaphor, imagine it as being like a bush, or a small tree. They look like, they're blebs that kind of grow out from that glandular line. Mm-hmm. The other thing is fibroids, which are uterine tumors. And those, again, destabilize the lining and cause bleedings. Mm-hmm. Those are the main ones. So, is a woman not ovulating? That can cause abnormal bleeding. Is there something inside the uterus, like a polyp or fibroid? We got to figure that out. And then there are a bunch of other things that cause bleeding that are less likely, but also common enough that we take into account. For example, other medical issues. For example, thyroid abnormalities or other hormonal abnormalities that have to do with the brain.
Okay.
And just underlying physical condition, stress, anxiety can disrupt the mechanism that stimulates the ovary to produce an egg. And rarely there can be other abnormalities like, sexually transmitted infections can cause abnormal bleeding, and bleeding abnormalities. And there are certain conditions which many of us have heard about that cause people to clot or not clot normally.
Oh,
and so,
okay.
If you're it's important for the uterus to be able to bleed, but it's also important for the uterus to be able to stop bleeding. And that has to do with our clotting mechanism in our body.
Yeah.
So, a lot of the times we can sit down as gynecologists and talk to a woman and without even doing an ultrasound or any other lab testing, oftentimes we can come up with a pretty good reason why she is bleeding just by talking to her.
Now, I have a quick question, sort of in the discussion of irregular bleeding. Is there sort of levels of alarm, like when you're talking about sort of amounts? I guess the question that comes up quite often is the color an indicator? No. So bright red versus darker red blood or anything like that?
Not really.
No. So would clotting be a different, that would be a different issue, like what you're talking about?
Well, if somebody had a significant clotting abnormality, again, when you talk to somebody, you'd probably find out that this wasn't the only situation in which they might not clot normally. So, for example, they brush their teeth and their gums bleed, mm-hmm. or they have trouble when they get cut. They cut their arm or scrape their arm, and for some reason it takes longer for them to bleed, to stop bleeding. Mm-hmm. If you talk to them in their family, sometimes people have had trouble with post-operative complications after surgery because of bleeding.
Okay,
they tend to run in families.
Okay, so there's sort of a path you can follow for something like that.
Exactly.
Okay,
so we have to keep that and take that into consideration. What is there something in the uterus, a polyp, fibroid? Is there some other medical condition? Some hormonal abnormality, and then finally, this is rare, but there's always the concern of cancer can cause abnormal bleeding too, and cancer of the uterus is very rare, especially in younger women. But as women start to get into their late 30s and 40s, we have to kind of put that into the diagnosis of what we're looking for.
Yeah, absolutely.
Yeah, so we talk to people, find out what their periods are like, if they're regular, if they're not regular. Do we get do we get the sense that they're ovulating normally? Because if they're not ovulating, that very well could be the reason for their abnormal bleeding. Mm-hmm. And the easiest way we treat that, frankly, is we oftentimes will use birth control pills. We don't have to use them. Sometimes we just use them for a month or two. And they're not for birth control. They're really for hormonal manipulation of the uterus. We will oftentimes give people progesterone in the form of birth control pills to stabilize that lining. And then, I know this sounds terrible, but we got to mow their lawn.
Right.
Sometimes we got to mow your lawn for you. If your husband is just feeling lazy, if you're feeling lazy, you're watering your lawn all the time, but nobody's mowing it, you better hire somebody to mow your lawn for you. And that's what we do as gynecologists. We will mow your lawn.
I can't wait till somebody takes that quote out of context.
We will.
Yeah,
come on in. We'll mow your lawn.
Exactly.
And so we use a lot of different ways to do that. Oftentimes birth control pills or progesterone, to actually give progesterone, that lawnmower effect, to thin the lining out. And oftentimes people will start to ovulate again on their own
So it's kind of like a kickstart to get
it's
it
like
going
a
again?
kickstart. Yeah, the thing is that women can stop ovulating for a lot of reasons, and oftentimes it's just temporary. They can be under stress. They can lose weight. They can be exercising more. There can be new medications. But it's not uncommon for, if I'm talking to somebody, find out, well, they just moved to Minnesota and they've been started a new job and they're stressed out.
Mm-hmm.
That can cause people to stop ovulating normally. Anything that affects the brain, because the brain stimulates the ovary to produce estrogen. The estrogen thickens the lining of the uterus. The ovary also produces the egg and ovulates it to make the progesterone. So if you are disturbing or disrupting that mechanism of the brain to the ovary, it'll screw it up.
Yeah, absolutely.
Stress,
and it sounds like it doesn't take very much to do that.
No. Women are very finely tuned.
We're wondrous creatures.
Right.
We are.
And so, we can manage hormonal abnormalities with giving progesterone and estrogen to stabilize the lining, thin it out, and that sort of thing.
Mm-hmm.
Oftentimes, we will do an ultrasound. Very frequently, we'll do an ultrasound to look at the uterus to see if there's something that is suggestive of a fibroid, for example, which is a benign muscular tumor. We can look at the lining of the uterus to see if it looks abnormally thick.
Okay.
And look for other abnormalities that in the pelvic area that may be contributing to it. So basically, when we're doing an evaluation for this, oftentimes we're talking to people. We're going to suggest an ultrasound. Sometimes we'll biopsy the lining of the uterus, and we'll do blood tests to make sure that some of these other hormonal levels are normal. We'll check thyroid levels and that sort of thing.
Okay.
And virtually always, we can come up with a solution to this. And sometimes the solutions are easy. Like I said before, bleeding because your grass is too thick, we just need to mow the lawn. And usually we can do that with hormones, like either high-dose progesterone or birth control pills. Sometimes we need to use surgery to do it. And so we can go in and do, people have heard of a DNC, a dilatation and curettage, where we will go in and, mechanically actually scrape that lining away.
Right.
And that can temporarily be very helpful sometimes.
Okay.
And then there are other procedures. If those things don't work, then there's another somewhat complex decision tree of where you can go. But then you have to decide whether there are procedures that we can do in the office and sometimes outpatient surgery where you can destroy that glandular lining that bleeds every month, kind of remove the grass, so to speak, down to the dirt.
Oh.
So that would be an ablation procedure, for example. You may have heard me discuss endometrial ablations.
Mm-hmm.
And those are outpatient procedures that can be very effective in people in stopping heavy bleeding. Intrauterine devices can be very helpful for this, for people who aren't ovulating normally, and their grass is getting too thick. I'm going back to the grass, Twila.
Well, listen, it's a good analogy. We get it.
And there's certain IUDs like Mirena, Kylena, Skyla that release progesterone. And so it's this low level of progesterone that's being directed totally at the lining of the uterus. So it's like you have a little like Zumba. Is that Zumba? Roomba. Whatever that thing is. That little Zumba is an exercise, right?
Wait, you are mixing up your metaphors.
I love metaphors.
So bad
Don't try to suppress me.
No,
don't oppress me.
You're now you're talking about room vacuums. Just
well,
the lawnmower.
You know the little
the Roomba. I know what it is. I used to have one.
They actually have a new robotic lawnmower too, and that's what the IUD is.
Okay,
it's like a little robotic. It's this continuous little lawnmower that
just kind of goes back and forth and back and forth,
mowing that lining down nice and thin. So there's lots of things that we can do, and ultimately, if you can't figure out what else is going on, and sometimes there's a condition called adenomyosis where you have an invasion of the muscle of the uterus by the glandular lining that is very hard to treat. You end up sometimes having to do a hysterectomy.
Oh.
And so,
but there are options.
There are many options, and actually, a hysterectomy for most people is one of the final things we will consider.
Oh, so it's it's very much a last resort.
It's a last resort for most people, unless you're dealing with other conditions.
Okay.
So sometimes if somebody has, for example, huge uterine fibroids, oftentimes we need to do that for that. Or if they have prolapse, or if they have pain for other reasons, if they have cancers, certainly we oftentimes need to take the uterus and the cervix out for that reason. But most of the time we can manage these conditions with procedures or medication that are less invasive than that. But again, the most important thing to remember is that you should have a regular period that's 3 to 5 days apart, lasting less than a week, with no bleeding between periods. That's the most important thing. If you are having bleeding between periods, if it's very heavy, and we talked about that, if you have, and the frequency is either closer together or farther apart than that, you got to get in to see somebody. Whether you understand my crazy analogy about the lawnmower and grass and water, it doesn't really matter.
Right.
That just helps some people kind of understand what is happening on sort of the glandular level of the lining. But really, if it goes beyond those parameters of normal, you need to get in to see somebody. And it's virtually always easily treatable. And the treatments are done, for the most part, in the office or in outpatient surgery.
Absolutely.
Don't suffer. That's my motto.
Yeah, don't suffer. Well, we always say that, don't suffer. You can get some help. You should get some help. So,
right.
As always, if you like what you're hearing, if you have comments, if you have suggestions, if you want to know more, the best place to go do that is our Facebook page. So go to Facebook and go to the little search bar and type in The Gynocast, GYNOCAST. You can request to be a member of the group. It is a closed group. We'll make it really easy for you. We like to have these conversations stay respectful. We like these conversations. A lot of times people talk about sensitive issues here, and we want people to be as comfortable as they can possibly be. So you just request to be a member. We vet you. The vetting is super easy. And then we let you into the group. We have lots of discussions, lots of great, interesting discussions. Sometimes we carry over our topics from here. We share information. We share articles. We provide support. We answer questions. It's a great community. When you're in the Gynocast group, you can also select, there's a lovely little send a message option where you can click on that and you can get in touch with us. You can leave us your questions. You can leave us your comments. If you want to do something anonymously, you can do that there. And it's the best place to sort of communicate with us about the things that you're hearing here and things you can even make suggestions on future show topics and things that you want to hear us talk about. So, I mean, it's the best. It's probably one of the most supportive communities I've been a part of. I really enjoy being a part of the Gynocast community.
That's right.
And I love seeing the development of this building and growing community.
That's right. Be part of our universe.
Part of our universe. I like it.
And this is as you're listening to the Gynocast, cast the Gynocast net out. Spread the word.
I like it. You've got some really great tags in here. You're just
Come on back to us.
You're doing a good job with
Join
that.
us.
I like it.
Thank you. I like it.
Well, thank you so much for listening, and we will be back next week.
See you soon.